community, Chloe, and welcome to another edition of Her Story RVA, Virginia Maternal Quality Care Alliance. We are excited about episode number 7. I want to welcome you and welcome you and welcome you. It's a virtual women's empowerment series curated with Black women in mind. This episode is sponsored by Virginia Neonatal Perinatal Collaborative. Now, I want to introduce to you some of my great special guests. Now, we're back at it again with Urban Baby Beginnings, representing Virginia Maternal Quality Care Alliance. As a recap, UBB is one of the 5 organizations that makes up the MQCA. This evening, we will be discussing the importance of respectful care. Let me repeat that, respectful care, hubs, and the community connection that UBB provides. We're joined again with founder and executive director of Urban Baby Beginnings, Stephanie Spencer, as she continues to share resources and connect us with all things Maternal Quality Care Alliance. Stephanie.
Hi, Clovia. It's great to be back. Thanks for having us.
Happy New Year. I haven't seen you since last year.
It's been a while, I know. And now we're in 2024 and in February. So only good things are going to be happening in 2024.
That's right. We're going to give them more. And I'm also excited to reintroduce Candace McDaniel, who is the Clinical Integration Manager Deputy for UBB and the Certified Community Doula. Candace McDaniel, Happy New Year to you too.
Happy New Year. Thank you so much for having me back.
Welcome back again. And we do appreciate you being here, as you were with us with UBB's episode in the past for our doula support services episode. All of the episodes have been wonderful. So we're going to jump in. According to the CDC, 1 in 5 mothers overall and approximately 30% of women of color report mistreatment during maternity care. This, coupled with high maternity mortality rates, shows that there is a serious problem with respectable care in the maternal health arena. Now, Stephanie, can you talk to us about the meaning of respectful care and why it is so important for Urban Baby Beginnings?
Yes, absolutely. And thank you for such a great introduction, because it's something so important in relation to the care for women, more specifically women of color, especially when they're receiving prenatal, postpartum, and birth support, alongside of other things as well. And I really think about respectful care as when I enter into a space, whether it be a clinical provider, a hospital system, or community, that first I am looked at and regarded as a person that is of value. When someone is looking at me, that they haven't prejudged me before I've had an opportunity to talk about what's going on. And that when I receive service and support, that is the highest level of support that every person would receive, regardless of presentation. And so I think that those things are paramount. And then last, in respectful care, that when I give information that may not be what you expected, like you didn't like how I said it, or you didn't like what I was saying in general, that's not brushed to the side, and I'm not someone who then has to deal with how you feel about what was said to you, is the fact that I have a problem. So my issues aren't so I would say that all part of that.
Okay. Thank you so much for that, Stephanie. And what does UBB provide that falls within the respectable care category?
So one of the things that we have done, and this is really a movement across the United States, but in Virginia as well, is to ensure that we have advocates who are appropriately trained and trusted in the community to provide direct support and services. So if you followed along our journey, you know that we have trained over 250 community doulas, all community doulas of color, to ensure that when people are receiving support, that they're receiving the support from folks that look like them. We know that studies show that when people receive support by those who look like them and who are trusted in the communities, that in itself can change outcomes. So at Urban Baby Beginnings, we ensure that is part of our value, and that when someone is engaging with us, that they have individuals who, are just like their next door neighbor. And that has been really important to us. Lastly, I would say that based on our training and our resources, we ensure that when people come into our organization, that we we know that they are very aware of how to provide appropriate levels of care, and we hold them to that high standard. Every person that is engaging, and also every person that is working within our environment.
This is so important, and I'm so glad to have you here this evening. Now, Candace, as a community doula, I'm sure that respectful care is always at the top of mind for you. Can you remind us of what a community doula is and why they are essential? What inclined you, Candace, to become one?
Absolutely. A community doula is a trained professional that provides that emotional, physical, and educational support in the prenatal period, during labor, as well as in the postpartum period. We're not medically trained, but we do work closely with the medical team, supporting the family to have the birth that they desire. Having support with the doula, you are feeling empowered and educated. You're likely to have a shorter labor, initiate breastfeeding longer and sooner, and just have an overall more positive birthing experience. I personally became interested in birth work because of my own personal birth trauma. I have three wonderful children, but I also experienced my first loss when I was 21 years old.
Mm.
I didn't know what a doula was. I didn't know what a birth worker was. I just knew that at that moment, the way I felt in that doctor's office with the medical team was something that no woman should feel.
Mhm.
I felt very dismissed and alone,
Yeah.
and just it was just very a painful experience. And I definitely didn't want any other woman that looked like me or any woman in my community to feel that same thing. So that was what inspired me to become a birth worker. I think that as women, especially as women of color, we have a right to have the birth the way we want, regardless of what the
Yes,
situation is.
absolutely.
It doesn't matter if you're young, you're old, single, married, um, Medicaid or private insurance. You have the right to be respected and heard in those spaces.
Mhm. Candace, thank you so much for sharing and for all of the folks who will join us this evening. And I am so glad that we're having this conversation because I did have an OBGYN who looked just like me. So she understood exactly what I wanted with the birth, even how we were going to do that C-section and where I was going to be cut. All right. Dr. Royal got to shout her out. But for those who are experiencing that, I would have never known because I didn't experience it. So I'm thankful that we are here this evening having this conversation. And I have another question for you. You know, I'm always full of questions, right? What does respectful care mean to you? And how do you respectfully include it in your care? I know you touched on it, but go delve deep into it.
Yeah. So I'm
Absolutely.
a registered. Oh,
Okay, well, you want to go back? You want to, well, Stephanie, you want to take this one?
I don't have to. Let Candace do it.
Yeah.
Well, for me, I just think that respectful care personally means feeling safe, being heard and supported. I think a lot of times, a lot of medical providers don't realize that they're not providing respectful care because what they are doing is just not hearing their client, ignoring us, not hearing our cry for pain. It devalues us when you're not listening to us. If I'm saying that, I'm in pain or I want this, and you're just ignoring me or brushing me off, that really does devalue us. And that's not providing respectful care. As a doula, I feel like I provide respectful care by centering my client. The laboring person is the center of everything I do. This is the person that I'm focusing on. This is the person that needs, desires, and wishes is the main goal. So, despite what I feel, what I think is best, it's really up to the birthing person.
Okay. Thank you so much for that, Candace. UBB seeks to raise awareness of respectful care and promote healthy equity. They believe that all women should be trusted to make choices that are best for them. Their vision is that every person of childbearing age in the United States has access to high quality, culturally tailored maternal health hubs. Now, This leads me to you, Stephanie. Can you explain the importance of maternal health hubs and why every person of childbearing age in the U.S. should have access to one?
Absolutely. So, many moons ago, raising a family, birthing was really the center of the community. When a new baby arrived, everyone, pivoted to be able to support that individual, grandmothers, dads, on down the line. And since that time, that has really transitioned because families are transient, they are spread out in many different states. There's just a lot of things going on with families today. And what this hub is that it reminds us that we need to recenter community. And hubs are safe spaces where pregnant and postpartum people can go and their children up to the age of 3 to get some level of support and resource, regardless of your insurance status, regardless of what you say, what you do. You will always have, if we are involved in the community, access to someone that you can go to talk about what is happening in hopes that they can help to connect you with the services and support that you need. I think for communities, because we've gotten so far away from just that community aspect of care, that it does a disservice to families because one of the things that moms are and their lack of care coordination, being very confused about where to go to get that.
Yeah.
But there are so many people that are out there that are dedicated to really ensuring that families get the care and services that they need. We said, you know what? Why don't we ensure that communities have that space? So what you see are we have 4 maternal health hubs today in different locations, and you see people like us, like Candace, myself, other nurses, doulas, and community coordinators. We have classes and groups and all of these things that allow families to thrive. And for the first time, we're able to really say that, because of the work that we're all doing collaboratively, it's not just about UBB, but it's about community too, that people can have a sense of belonging in that maternal and child space. And so that's what hubs represent. And why they're important is because when people are isolated, they don't do well. There's this study that is out, it's called Friendship as Medicine. And it talks about the fact that when people are really socially isolated, that their mortality rates are much higher. And by simply implementing a strategy of friendship as medicine, we can mitigate those issues. We can reduce we can reduce mental health issues. We can reduce mortality. We can improve preterm birth rates, all just simply by saying that we care enough in community to bring people together to support them. And that's what the hub represents.
This is very good. And in other words, maternal health hubs or perinatal safe spots, families can be supported, empowered, and educated before, during, and after birth. Now, Stephanie, you talked about the support and having access to the perinatal specialist. Candace, as a community doula, what are some things that you've experienced and the impact it has had for families? How often do doulas visit their parents, patients, that is, and what do these visits typically look like? I'm trying to get a vision of it.
Absolutely. So our doula visits, Medicaid allows for prenatal, for postpartum, and the birth support. Our visits are really about building a relationship, especially those early visits. Building a relationship. Your birthing space is a very intimate space, so you have to be comfortable with the person that's sharing that space with you. So we do a lot of relationship building, especially in those early prenatal visits. Learning more about the patient or the client and their desires. How do they want to be? What is their birth story? They want their birth story to be. What are their desires? What are their wishes? What are their fears? We also do some educational pieces about, the stages of labor and comfort measures during labor. We do breastfeeding education, early childhood education, just a lot of information to make sure that that birthing person, as well as the support, because we include the family into our visits. So partners, family members, mothers, whoever it is. Your doula is, a temporary component, but we know that your family members, they're there for the long run, right? So we include them into the visits so that they can also understand what it is the birthing person does want, and making sure that they are all completely supported, so that they can have the desired outcomes.
Yeah. And this is also good for men too, because for some reason they think you
Absolutely.
can just drop the baby and keep it moving. Not. We'll find out for real. What is some advice you have for ones that could use the assistance and resources that UBB's doulas provide, but are hesitant to follow through with the necessary steps to request for one? And I want to start with you, Candace, follow it up with Stephanie.
I It's my belief that every person can benefit from having a doula, no matter, what your situation is it baby number 1 or baby 10. A doula can definitely assist you. Um, I think that UBB is a non-judgment zone. So we are judgment free. We take you how you are. We meet you where you are, and we will support you throughout this journey. So that's what you will get when you come into UBB. Definitely a sense of community, a sense of love, and we're holding space for you, and we will lift you up throughout your journey.
It's Stephanie.
Mhm. Yeah, I think if you're struggling to make the decision, that you need additional support, I think the first thing you've got to really do for yourself is to put yourself as a priority and really think about what support looks like for you. I can remember talking to moms in a class a few months ago about the fact that many women tend to not share what their needs are because they assume that everybody else knows what they need. And
Hmm.
in this one particular study, it talked about over 300 some odd women, more than 90% of the individuals within that study, um, and did not tell their partners and did not tell their families what they need, and they felt like very let down in that care. And not to say that families will let you down, because I don't want you to be thinking that, but I do want to say that the first start is to say, hey, this is a priority for us. And this
Hmm.
is what I believe that I need to do in order for me to feel supported, but also so I can continue to support this family unit. And when we speak from that perspective, I think that it takes away the guilt that we sometimes have when we ask for help. And you'll hear me a lot talk about this, Clovia. I'll say, stop being the superwoman because it's not necessary. And the reason why it's not necessary is because there are people around you that can help you. Urban Baby Beginnings being one of them, and your family being the other. But why not bring that all together full circle to help you while you are trying to bring in a new baby, while you're dealing with those normal day-to-days that are going on, in your life? And why not really focus on yourself and put yourself first? And if you are struggling, remember that when I say put yourself first in this, and it is okay to do that.
Right. That was very important, Stephanie, when you said it's okay to put yourself first. And I know folks are watching like, wait a minute, I don't put myself first. It's all about the baby, or it's all about getting back to the family. And I think for women who have had babies 30, 40 plus 50 years ago that didn't have the support, please take it easy on others. Please take it easy on others. It is a rough situation, especially if you don't have a loving family or a doctor, and or what doulas communicate. But if you have a doctor and you don't have a doula yet, it's really, really hard when you're not feeling a certain way and you don't feel comfortable sharing. And so for all of the folks who are viewing this tonight, even if husbands or partners call up, they can do that, Stephanie, right?
Absolutely. We have navigators that are available to answer questions, connect people with other resources in the community. We work with dads all the time. They come into our groups to ask questions about how to support the mom in the home. And we want them to know they're not by themselves. But the main thing is picking up the phone and really calling so that we are aware that you are in need of some level of support. And whether that be Urban Baby Beginnings or maybe that is something else, it just depends. We will work on that together. But we don't want anyone to shy away from just calling and saying, hey, I'm really thinking about this and I need a little bit more information. And can you all help?
Okay. How do we reach out to you to gain more resources and access, Stephanie?
So, a couple of ways. One is to go online at www.urbanbabybeginnings.org, and on there there'll be a plethora of information, but also there's a screen that says "Refer Now," and you can go in and refer yourself into our program. And you don't need a referral from someone else to do that. You can just say, "I feel like I need support and I need to get some assistance." The other way to do that is to call. So we are 24/7 system in English and in Spanish. And if you do call, the individual that answers will also get you to the right place as well.
So we have no reason not to gain the access that we need to have healthy babies, starting with
Yep.
our community doulas and also the respectful care. Lots of information shared here today. And we'll be back next month. And we're going to talk about how we tie all of this in. If you don't have personal insurance, Medicaid. Medicaid. So thanks to our sponsor, Virginia Neonatal Perinatal Collaborative and Maternal Quality Care Alliance. And thank you to our panelists, Stephanie Spencer and also Candace McDaniel. Thank you so much for watching. I am Community Clout. You're updated.